So Steve, tell me as a man, what was your view on your health before this incident happened?
All right. I'm a guy. I'm like, indestructible until I'm not, right? Which is the whole problem. And one of the best examples of this actually is the mission trip that we took to India.
In 2017, I participated in a mission trip in a small village in Guatemala. We were building power lines.
20 hours on a plane.
We flew by plane.
Then it's 10 hours on a train.
And we drove hours and hours.
Then it's 4 hours on a bus. We get home, and I noticed over that week or two that, man, my leg was kind of hurting. They did the ultrasound on my leg, came back, and he said, "You got a huge blood clot."
I just kind of noticed that my calf being really swollen and really, really hard, ended up having blood work done that day. The doctor on call, she actually said, "Get to the emergency room pretty quick."
Jamie and I are good friends, and we're competitors as well, right? So there I am at this go-kart race, and I'm not racing. And neither is Jamie Bell. We were in the same position of not being able to drive go-karts.
I found out that he was not participating for the same reason what I was not, because I had had a blood clot.
Like, how did this happen? I didn't know that you did. So we learned then that we each had a blood clot.
It made me wonder, whether there were people out here in the community that maybe had the same situation.
The signs and symptoms that one should be aware of, for example, in your lower legs, would be anything that is out of the ordinary for swelling, redness, and pain. Anything that is not your normal baseline. Call your provider right away. If it is getting worse and you feel that it is causing too much pain, we would direct those patients to go to the emergency room. After one develops a blood clot, for the most part, one can expect to have resumption of their normal daily activities without it being affected.
The difference in my life before and after is that I'm more aware now than I was back then. I can do basically everything that I could before.
I am more aware, but I don't feel like the blood clot has changed the way I do things or anything that I can or can't do. A lot of men think that if there's something wrong, that it's just going to go away.
We just have a way of saying, well, I'm healthy, I'm fine. That's going to pass. But sometimes it doesn't. It could have been a very different outcome. And it's a very easy thing to get checked.